Hello guys, my name is Nightwolf and welcome back to some more surgery games. So, that's good. Okay, so now we are going to be doing cataract surgery, rhinoplasty, a C-section, laser tattoo removal, root canal, laparoscopic gastric bypass. Maybe not the C-section, don't know yet. But, so yeah. And this will be the last episode of the surgery games. So, yeah. No more surgery games after this. At least not of this kind. So, yeah. So let's just start.
Hello, and welcome to Surgery Squad's Cataract Surgery. I'm Dr. Susie, and I'll be guiding you through this procedure today. A cataract is a clouding of the lens inside the eye. The lens is located behind the pupil and focuses light on the retina. A cataract causes loss of vision that can't be corrected with glasses, contact lenses, or even LASIK, so it must be surgically removed. We're going to remove the clouded lens and replace it with a new one called an intraocular lens, or IOL. The surgery takes about an hour and can be done on an outpatient basis. Today, our patient is a 66-year-old woman who has noticed an increased blurriness in her vision, as well as decreased night vision. She saw her eye professional and she detected cataracts and recommended her to us for surgery. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put her to sleep.
Okay. Same thing as always with these eye surgeries.
Just prior to surgery, additional drops of anesthetic are applied.
Okay.
We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please.
Yes.
We begin the surgery with a small, painless initial side port incision. This is called a limbocorneal incision. It's done by making a small cut in the limbus with a crescent knife. Next, we use the crescent knife to make a corneal tunnel into the interior chamber of the eye.
I think we already did this. Yeah, we already did this. Okay, so we are not doing this again. So let's just go ahead to laser tattoo removal. I have a tattoo. It's pretty awesome.
Welcome to Surgery Squad's laser tattoo removal. I'm Dr. Susie, and I'll be assisting you with this procedure today. According to a recent poll, over 50% of those with tattoos want at least one removed. They cited being too young when they got it, a new career, or significant life changes, such as divorce or childbirth, as reasons why they no longer want them. Luckily, there's laser tattoo removal. Laser tattoo removal is a procedure that uses a powerful laser that reacts with the ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched. After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after multiple treatments, those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade. Our patient today is a male in his mid-20s that got a tattoo on his calf when he was a teenager. Now that he's older, he doesn't see the tattoo as being so attractive anymore. In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him. Before we begin, we need to go back in time to the day he picked out his tattoo.
Okay.
Help him pick out a real winner. Use the arrows to scroll through the tattoos. Click Choose when you have made up your mind.
Okay. So we have Warden Bones. Okay. Not that great. Oh. Ooh, that's That tattoo artist needs to be fired. Spring Break 99. Dates? No. That's pretty cool. Princess Beth. His kid, I'm guessing. Type text here. Oh my god, I can actually... Llamas! Can I actually do this? Yeah! Llamas with hats we're going with. If you haven't seen llamas with hats, it's amazing.
Interesting choice. The heart's a nice touch. Let's make that tattoo disappear.
Yes.
During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any discomfort he may experience. Other than that, there really isn't any other preparation needed. So let's get started. A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time. So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
Jeff's Instant Chill Pack. Non-toxic and reusable. I like Instant Chill Pack.
That will do. Now we need to use the laser to fade the tattoo. Different types of lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result. To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated.
Is that a needle?
Let's start by targeting any red or orange ink areas.
That's pink. That's not red or orange.
Next up is green, blue, or other darker colors.
Did that feel good? Yeah? You like the pain? Huh? Yeah. Pain.
Finally, we'll remove the black.
See, mine is only black. So I don't have to, and it's not that big either.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area to relieve some of the pain. You did great! Our patient is ready to go. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the treated area.
It's like getting a real tattoo. You need to keep it covered.
As stated earlier, our patient's tattoo will only begin to fade after multiple treatments. So we shouldn't expect the tattoo to go away during one session. While the tattoo may not be completely removed, it should be lighter and much less visible than before. And that's laser tattoo removal. Well done!
Good.
Why not try your surgical skills in another surgery here on SurgerySquad.com?
So we have cataract surgery, we already did that, and a wisdom tooth extraction. We aren't doing a wisdom tooth extraction. No. Instead, did I already do that? I can't remember. A laparoscopic gastric bypass is what we're doing.
Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr. Jeff, and I'll be your guide for this procedure. Are you ready? Let's scrub in.
Well,
Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine. There are several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes.
Yeah.
Our patient has been prepared for the procedure
Nice
with a
job.
mild sedative, and now the anesthesiologist places a mask over her nose and mouth, and she'll drift off into dreamland. From here, we'll place an endotracheal tube down the patient's throat. You're up.
Okay.
See if you can get the tube into place.
I am loud enough, aren't I? I'm pretty sure I am loud enough. Come on, no. I am a bad recorder. I have my phone on.
Great work. This tube is then connected to a respirator. The patient is ready to go. Now we can begin our laparoscopic procedure. The first thing we'll do is make 6 half-inch incisions in the abdomen. Slide the scalpel in where I have marked to make the incisions. Be careful, these are small incisions. Don't get carried away.
Don't cut him wide open.
Nice
You're
technique.
bad.
You must have an excellent teacher. Oh wait, that's me. Next, we'll place a device called a trocar into
nice
each incision.
Joke. That's not a nice joke. I don't like that joke.
These devices allow us to easily slide the instruments into the abdomen.
Okay.
Some of the instruments we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the
That's good
staple.
coffee. Okay. And yes, it is almost noon and I'm drinking coffee.
Now, to give us plenty of room to work, we fill the abdomen with
knife,
carbon
a
dioxide.
Staple. So, camera, knife, stapler. A saw. No, scissors. A scalpel. And an action button.
Let's face it, with a newbie helping out, we'll need all the room we can get. Time to start the gastric bypass. We'll use this monitor here to see our work. In R&Y gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg. We do this by first placing a line of staples that separate the smaller new stomach from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch. We'll now separate the small intestine from the old stomach, about 2 feet down. The lower part of the intestine will be connected to the new, smaller stomach with a half-inch opening between the stomach and the intestine. It's kind of like rerouting traffic on the 405. Use the electrocautery device to create a half-inch opening where indicated in the new stomach pouch. Now, drag the loose end of the intestine to the new stomach pouch to attach it.
Whoa, lag.
I'll add some sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small. Again, I'll suture it all into place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures. This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars.
The stomach where you digest stuff, not your... Well, I guess stomach breaks it down. Then it moves to your small intestine to break down some more and to take all the nutrients out of it, I think. And then big intestine to get rid of it. I think so. I don't know. I am not a doctor. Okay.
Now we need to suture each of the incisions.
Boom, boom, boom. I didn't know I had 3 arms.
Nice work. I bet that won't even leave a scar.
Now
Now our patient goes off to recovery. In most cases,
At least a
they'll
small
spend a
one.
few days here in the hospital so we can monitor their progress. Afterward, our patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits. You've been a great help. Why not try another fantastic surgery
Let's
at
see.
surgerysquad.com.
Lupendectomy or laser hair removal. We already did both those. Let's do a root canal instead. I haven't had a root canal done yet. But, I mean, why not start now, you know?
Welcome to Surgery Squad's virtual root
Yes.
canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection.
Okay.
Our patient today is having a root canal performed on their lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
Yeah, sure.
I thought so.
The tooth roots are removed. Are they?
Not even close. Remember, a root canal only involves cleaning, disinfecting, and sealing off the inside of the tooth.
Ah.
If the tooth's roots were removed, it would no longer have anything to anchor it to your jawbone.
Ah. Okay. Oh yeah, that part. I thought those were the roots. But, see, those are removed, aren't they?
Not true at all. It is very possible for a patient to require root canal treatment if they have never experienced pain from a tooth. This is why having routine dental exams is important. Often patients may choose to have a tooth removed instead of having a root canal. While this may immediately seem like a simpler and more economical choice, it's often the opposite. Having a tooth extracted and replaced with a bridge, implant, or removable partial denture is not only Let's move on. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on. Let's give our patient a few minutes to relax and for their mouth to become completely numb. Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth. Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
A tooth clamp?
Next, we'll need to dry out the tooth as much as possible using our air-water syringe. So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill. The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot. At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
What? You put bleach? Wait. I thought bleach was dangerous.
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
No music this time? Come on.
Great! Now use the suction to remove the bleach from the patient's tooth. Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can. Looking good. A heated instrument is now used to remove the excess gutta percha. Pack the gutta percha into the tooth canal using a plugger.
Oh.
After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com. After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal.
Smoking is a big one.
And that's a root canal. Why not check out some of our other amazing surgeries here on SurgerySquad.com.
We have a LASIK eye surgery and a childbirth epidural. We aren't doing either of those. No, instead we are doing a rhinoplasty. This is with a brachial nose.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery. I'm Dr. Susie. Today we will be performing rhinoplasty. It's what's commonly referred to as a nose job. In this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing. Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with a patient under general anesthesia and completely asleep. What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it. The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called. Alright, I'll tell you. It's an outfracture. Some patients may also want the tip of the nose reshaped. That's called tipoplasty. But as I was saying, this patient only wants an infracture and some reshaping. Easily done. To begin this procedure, we need to open the nostrils as wide as possible. We do this with a retractor. Can you place the retractor in the patient's right nostril? Now with the nostril opened wide, we'll make an incision inside in a crescent moon shape. That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril? Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell. To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome. We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
I have to do it. Okay. Ugh. Oh. Oh.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision. Now that the bump is out of there, we need to smooth the edges on both sides with a rasp. The space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils. Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect. A few stitches to close up the incisions, and then we place nasal airway splints in each nostril to hold things in place. Stera strips go across the nose, and an external nasal splint is added to hold everything tight. Our patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
We have a breast implant surgery or dental filler. We won't be doing either of those. Okay, so we are going to be doing a C-section.
Welcome to Surgery Squad's virtual cesarean section. I'm Dr. Jeff, and I'll be guiding you through this surgery today. A cesarean section, commonly referred to as a C-section, is an inpatient procedure where a surgeon makes incisions in a woman's abdomen and uterus to deliver a baby. This procedure is often performed when a physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects. Our patient today is in her early 30s and is relatively healthy, with the exception of a brief history of high blood pressure. Luckily for us, we get the opportunity to deliver her first baby. Now that we've covered the basics, let's scrub in. We'll begin the procedure by inserting an IV into our patient's hand so that we can provide her with any medication and fluids she may need. I've already tied a tourniquet on the patient's upper arm. Can you find a suitable vein in the patient's hand?
I like how over here, on where you guys can't see it, the C-section, natural childbirth and childbirth with epidural.
Looks good to me. Next, we need to sterilize the insertion area using an alcohol wipe.
And she's married too.
Now that the area is disinfected, it's time to insert the needle and advance the angiocatheter into the vein. Take a stab at
it. Wrong choice of words.
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container. I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line. Excellent job. Was it easier than you thought it would be? In order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord. and there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
Okay.
Next, we'll inject a local anesthetic to
orange.
decrease the pain the patient will feel when we inject the spinal anesthetic.
Could have just said, hey, put this orange liquid here.
So far, so good. Now we need to inject the spinal anesthetic directly into the patient's spine. Now just place a bandage over the injection site and we'll move on. Great.
Okay.
Before we can make any incisions, we need to clean the patient's abdomen with an antimicrobial iodine solution. Now use the scalpel to make the abdominal incisions. As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle. Are you ready?
Yeah.
It's getting a little messy in there. Use the suction to clear out some of the excess blood and fluid. Insert the retractor to push down the patient's bladder. Make an incision into the patient's uterus so that we can begin the delivery. Be careful though, we don't want to accidentally injure the baby.
Yeah. That would be bad. Like, yeah, well...
We're almost there. Sometimes
The
a
baby's
surgeon will
good.
need to use forceps to help the baby out, but not in this case. The next step is to apply pressure around the baby's head to assist us in removing the baby from the uterus. Before we completely remove the baby from the uterus, use the suction bulb to suction fluids from the baby's nose and mouth. Now, let's have a baby. Help me remove the baby from the uterus. Excellent, but we're not done yet. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Doing that.
It's a girl. Congratulations. Our team of nurses will take the baby to be cleaned, weighed, and examined before allowing her mother to hold her. In the meantime, we need to remove the placenta.
Hello.
To finish up, we'll need to close the incision sites. I think we'll go with absorbable sutures instead of surgical staples to reduce discomfort and so that our patient doesn't have to worry about having them removed. You can take it from here.
Come on.
You did an amazing job. Now, the recovery process begins. Since it may take a while for our patient to recover from the surgery, her physician recommended that she plan ahead by getting people to help her with daily tasks, such as grocery shopping, cleaning the house, or yard work. It takes roughly 6 weeks for the C-section incision to heal, and during this time our patient can expect some fatigue and mild discomfort. It is also recommended that during the recovery period, patients get plenty of rest, drink lots of water, and avoid intercourse. Our patient will need to contact her physician if she experiences any signs of infection, foul-smelling discharge, painful urination, or leg pain or swelling. It is also highly recommended that she contact her physician if she is frequently depressed, as this may be a sign of postpartum depression. And that is a C-section.
Okay.
I think you should test your surgical skills in another surgery here on SurgerySquad.com.
A mastectomy and a breast implant. Well, virtual surgery and silicone surgery. We aren't doing any of those. Instead, I am going to end this video right here, and I will see you. Make sure you guys like and subscribe, and I will see you guys on Monday. And we will probably be doing, well, either Plague Inc., starting that again, because, you know, it's fun and everything, or something else. And plus, yeah. Once I get done with the present on Monday, hopefully I'll be done with that present by then. Well, that episode. Then I'll have to figure out a video to go there too. So, yeah. Lots of stuff happening. But anyway, I will see you guys on Monday, and have a good weekend.